Obesity is a chronic, complex condition, yet we still seem to approach it as if it's some kind of willpower game or some moral failing.
There's a lot of noise around this topic, and for sure one of the biggest talking points is around weight loss medications. I know so many people out there that view these medications as a silver bullet.
It will be a tool that might enable you to lose weight easier than without it. It won't itself fix your lifestyle. Real weight loss comes from long-term, sustainable, small changes that are consistent with what works for you. But it's hard.
Even though some people don't feel comfortable with it, that's why it is important we're having this conversation. Hello everyone watching, and welcome to the latest episode of Inside Health. I'm Dr Zoe Williams, and today we're talking about the truth when it comes to weight and health. Now, weight and obesity are dominating the headlines, from the rising rates of obesity to weight loss drugs. And there's a lot of opinion, there's a lot of noise, and there's a lot of confusion. So today we just want to step back and ask, what do we actually understand about managing weight now? And what does that mean for our health? I'll be talking to clinical expert Dr Petra Simic, who's also the medical director at Bupa, and she'll be helping us unpack why weight management really matters and the different ways that it can be supported. And I'll also be joined by Nuala Armstrong, one of Bupa's health coaches, who'll talk about the everyday tools and habits that can help people make realistic long-term changes. So I think before we get into talking about management and treatments, it's really important just to zoom out and I think just make the statement that obesity is a chronic long-term disease. And I think for a lot of people, it's a highly emotive disease to talk about. So what are the conversations and comments that you're experiencing when it comes to the topic of obesity right now?
So I think what I'm recognising is that for a lot of people, they worry about talking about their weight, particularly to a medical professional, although they want to, and often they're guided to. They may have had quite difficult previous experiences of talking to medical professionals about their weight, or have had their weight brought up at a time that they're not ready to talk about it. So I think where we're at is we need to start to break down the stigma and allow people to have those conversations and to recognise that some of our medical professionals might need upskilling and training. Like you say, obesity is a chronic, complex condition, yet we still seem to approach it as if it's some kind of willpower game or some moral failing.
We still seem to put that idea of that there's blame on the individual, which actually doesn't make sense at all, especially when you consider that nearly a third of adults in this country are living with overweight or obesity. So it's definitely not down to the individual. There are more significant things at play. I think with the emergence of weight loss medications in recent years, I've noticed actually a really significant shift in a lot of my colleagues' ideas around obesity. And I feel like it is perhaps landing now, even with people who it didn't before, this idea, that obesity is a chronic disease. And I think that's one reason why the emergence of medications has been helpful, because it's shown now there's a treatment. You have to acknowledge that this is a disease, similarly to how you do for things like diabetes and thyroid problems and hypertension and high cholesterol.
Well, you'd think, wouldn't you? And that's what I thought would happen. The emergence of a treatment would mean that people are much more comfortable putting obesity and overweight in the box that we know it should be in. The World Health Organization have made it really clear this is a chronic, complex condition, the biology, the science. But I still find myself, even in rooms of very educated people, being challenged at the notion that this is a disease. We're still very stuck on this belief that there is in some way a choice.
I've found myself using this little example to challenge people back recently, saying that 100 years ago, it was estimated that approximately 5% of the population had a BMI that was in the obese range. And now it's around a third of adults have a BMI in the obese range. And it's predicted that by 2035, 50%, it could be 50%. So what has changed? And I often say to people, do you really think it is that 50% of the adult population have gone from being good people to bad people and who are lazy and have no willpower? Or is it that our environments have changed so significantly, the world that we live in has changed so much, that we're now in a place where only roughly a third of adults have been able to maintain a healthy weight despite those changes, largely down to their genetics and their privilege? And I kind of think people are like, oh, okay. Because of the numbers, 2/3 of adults, almost 2/3 of adults are living with overweight and obesity, and actually 1 in 5 children living with obesity. If it's not down to individual choice, which it's absolutely not, what is it down to?
Like many other chronic diseases, living with obesity or overweight is down to 3 main components. So we have genes, environment, and lifestyle, or you could say behaviour. Over the last 100 years, you've already referenced that the prevalence of obesity has massively changed. Our genetics have not changed in 100 years. Our environment is very different, as is our lifestyle. So we have an environment where we are exposed to hyper-palatable, high-energy foods, very easily available. We have a lot of ultra-processed food. And we have a societal change where it is quite normal to have quite a sedentary lifestyle and access to unhealthy foods, and a predominance of that in our societal choices. So we are around a very different food environment than we were 100 years ago, and our levels of activity have changed dramatically. Our genes are nowhere near catching up. Genetics plays a much bigger role than people would have ever thought 50 years ago. And at the last conference I went to, it's estimated that there are over 9,000 genetic variations that increase the likelihood of you carrying excess body fat. Wow. And the more of those you inherit, the higher the body fat is that you are likely to carry. And a study from the University of Cambridge has also proven that individuals that have inherited more of those genetic variations might have to walk 10,000 steps a day more than another person just to keep their weight stable. So I think we've always looked at weight as if we are all identical humans. Yeah. But we know that we're not identical humans. We know this just by opening our eyes and looking around. And it's not just our choices that make it different, but it's our genetic makeup that is absolutely making it much harder for some people to achieve or maintain a healthy weight in our obesogenic environment than others. We are not equal, and we are all having to fight a different fight. And it's about recognising people or individuals. That's really important in this.
I think sometimes I find it helpful to give examples as well of how those genetic traits may play out. And there's 3 that I often give. So the first one would be satiety regulation. So that's like we've all gone to a buffet with friends, and one person will eat 1 small plate and that's enough for them. And one person can eat 5 large plates and then eat more. And that's like largely down to your genetics, your ability to consume a certain amount of food. In a world where we now live with such abundance of food, you can see how it would be much more difficult to maintain a healthy weight if you're the person who can actually eat more and enjoy eating more. The second one being food preferences. So some people genuinely will choose to put a salad and some lean protein, and that's what they enjoy. Whereas many of us, the majority of us, probably, if we chose what we really wanted, we'd be getting burgers and chips and ice cream. But if your food preferences sway you towards those less healthy foods, with the food environment that you've already spoken about, ultra-processed, ultra-palatable foods, it's a challenge. And then the most interesting one I think about is the food responsiveness. So this is the example of one person goes into a petrol station, they pay for their petrol, they come out and you say, what snacks were there? I don't know, didn't look. Another person would be able to come out and say, well, they had these bars, these chocolate bars, crisps. Couldn't see the sweets initially, so I looked around the corner, they had this on offer, and people will know if that's them. That's people who are very responsive to food cues. And going back to our grandparents, they really had 3 food cues a day, 3 opportunities really to think about food when it would be on offer. Whereas now I think we have about 200 food cues a day. So even at the checkout in a clothes shop, there are sweets and the billboards and the social media. You're constantly being fed images of food. So if you're highly food responsive, then it's really difficult. And you can start to see you're layering all these genetic traits on top of each other. If you're somebody who has inherited the type of genetics from your parents that leads you towards the more extreme examples, it's impossible. It's not about willpower. It's just, it is much more difficult for you genetically to maintain a healthier weight as our environment has adapted over time.
I agree. And I think the genetics thing is really fascinating when you start to think about it. Some people love marathon running.
Yes.
Some people are very talented athletes.
Yeah.
I think the neurology of living with overweight and obesity is going to be a really evolving science in the next few years as a result of what we're learning through the effectiveness of current weight loss medications. People are talking about how the brain is an important organ when it comes to eating, the types of food you eat, when you eat, why you eat. And I think this is, we're in a real kind of moment of renaissance, I think, for understanding the human body, metabolism, etc. But it's about being scientific about it, and taking away the stigma and the emotion will get us to a much better place.
And that's before we've even started to talk about certain conditions that might make it more likely to gain weight, medications or, emotional reasons that you might turn to food for comfort. So it really is complex, isn't it?
And I think that's a really important element that people often forget is biologically we are designed to store energy and to do it really well. Like the best genes for human beings are ones that can store fat efficiently and then mobilize it when we need it. Because up until recent years, food insecurity was a genuine risk to human life, whether it be famines, whether it be conflict, there was no guarantee of the next meal. And so being able to store food as fat in our body is a brilliant biological ability, but it means that we have it means it's very hard for us to lose weight. So there are hugely powerful biological drivers. That means that when we go into calorie deficit, and energy deficit is what you need to be in to lose weight. There's no magical answer to that. But if you are in calorie deficit trying to lose weight, your body is fighting you. It thinks you're trying to kill it. And so it will send you hunger signals, very, very hard to ignore hunger signals. It will drive you very hard to try and eat, because biologically, that's what the body is designed to do. So being in calorie deficit is hard. Being in calorie deficit for long enough to lose enough weight to make a difference to your health is really hard. And doing that in an environment where it's very easy to consume very tasty calories.
Especially if you have these genetics that drive you to eat even further. You start to see why people start talking about it as you are fighting your biology. And this is why people can overcome that with willpower for a few weeks or even a few months and go on a crash diet and lose weight. But this is why it's not sustainable, because you actually cannot fight against the very human nature of your biology, which is driven by hunger, for longer than a short period of time. And that's why these methods don't work sustainably over the course of a lifetime.
And it's really important to say, it doesn't mean there's nothing you can do. Because I think where some people hear, it's a chronic disease and it's genetics, okay, so there's no point in trying. That's absolutely not, I don't think, what either of us are saying. What we're saying is we recognise that this is not just hard, but when you take a step back, you wonder how it's even possible for anyone to do this successfully, especially if you have quite a lot of weight to lose.
Well, I think that mindset of starting to understand that my body's not broken, I'm not broken. Actually, my body's just trying to keep me alive. My body's actually doing an amazing thing. Once you understand that and start to talk about the methods of managing weight that do work long term, which we'll come on to, you almost need to understand that first of all, that, this is not that you are broken. This is your body keeping itself alive.
Completely. And I think that being very realistic about what one's goals might be on a weight loss journey is really important. The commonest thing I come across is people who have been on multiple weight loss journeys, and they have very unrealistic expectations. They expect to lose, 3 or 4 pounds a week. And they might have done that for the first couple of weeks of a diet.
Yeah.
because they lose water weight, their body composition changes. But the truth is that amount of weight loss is not sustainable. And so they then drop down to losing maybe half a pound or a pound a week. But it's taking an awful lot of effort for them. And they might even have a week where they don't lose weight at all. Maybe if they're a menstruating woman, they'll have fluctuations in their weight, even just a change in the type of food they've eaten, whether they're constipated or not, exercise, that can affect weight loss.
And stress.
Right.
Because add stress into the mix, your body thinks that you're in danger. Well, then all those methods of conservation, storing fat when you do eat excess calories, or, you know, when you have that brunch at the weekend with the girls, okay, better store, because the famine starts again tomorrow.
Right. And so they don't lose any weight for a week or two. It's been so hard. They quite rightly say, well, I can't do this anymore. And so we end up in this yo-yoing. And that is what's so difficult. And I think it is entirely possible to lose weight without any medical treatments. But what it takes is a very realistic goal, target, actually very sustainable changes to lifestyle, real reflective work on what you can do and sustain. And I'm not sure that that's the kind of dieting patterns that we've seen in people. We've seen people crash dieting, repeated dieting, but real weight loss comes from long-term, sustainable, small changes that are consistent with what works for you. And I think timing's really important. There are some times in people's life where it's just not going to be possible. They can't set up the right lifestyle environment. They haven't got access to healthy foods. They may not have the cooking skills. They may be injured. And actually, for a while, you're not going to be able to be very active. So maybe don't choose this as the time to do it. So I think it is about working out if it's the right time for you to make sustainable changes, because going on a weight loss journey that is unsuccessful actually can be really demoralizing, can increase stress, and long-term probably not help at all. So, you know, choosing the time, making sure you've got the tools, and being really realistic about the goals that you're trying to achieve. Not everyone needs to be the same BMI. There's a brilliant picture I saw a couple of years ago of the Olympic team. It was, there was probably about 80 individuals. And what you saw in that was all the different body shapes of elite athletes.
Yeah.
They were all performing at their best for them.
Yeah.
And I really keep that in mind when I have conversations with people, because what I ask them is, what do you want? What's good for you?
Yeah.
What's a fighting weight for you? What would feel great for you, so that people stop comparing themselves to others?
Yeah. Sometimes people do blame themselves when a diet doesn't work, or when a diet does work, but then the weight comes back, which is what we see a lot of. But dieting, for some of the reasons that we've already highlighted, it's actually much harder than people realise, isn't it?
Yeah, so I think people underestimate how much you have to change your intake or output to lose pretty modest amounts of weight. So to lose a pound of fat, which for some people doesn't feel like a lot. A pound of fat is actually in volume about the same as a can of soft drink. So it's quite a large volume.
Yeah.
But to lose that in weight, you have to be in a 3,500 calorie deficit. And you can achieve that
per week.
Just full stop.
Right.
So if you were going to lose a pound of fat,
time.
you have to be in a calorie deficit of 3,500 calories. Okay. So you could do that over a month.
Yeah.
Which would be relatively easy. But a lot of people have a kind of a pound a week in their heads as their kind of...
Yeah.
So that's to be in a 500 calorie deficit every single day for 7 days of a week to lose a pound of fat. And then to flip that around, to gain a pound of fat is actually, you have to be in a 3,500 calorie excess.
Yeah.
That's actually relatively easy
Very
as well.
Easy to
and
do.
I worked out that if you had a cappuccino a day above your maintenance energy levels for a month, you would gain a pound. That's a cappuccino a day. So it's quite easy to understand that it's small increments regularly that make a difference. There's a bit of a misconception around exercise, Zoe, that I'd quite like to
let's
do a little bit of myth busting.
I'm
here.
the biggest exercise advocate there is, but I know what you're going to say, and I agree with you. It is not the be all and end all
It really
when it comes
isn't.
to weight loss.
No, and you can't out-exercise a poor diet. So that's kind of a well-spoken phrase. The problem with it, so the brilliant things about exercise, I think we'd agree, amazing for strength, amazing for mental health, brilliant for cardiovascular wellness, love exercise. Genuinely one of the best things you can do for yourself. For weight loss, it's not great though.
No.
And for some people, it's quite counterproductive.
Because it makes you hungry.
It does. And that will be affected by your genes.
Yes.
For some people, it really drives hunger. And if we go back to some of those biological features, of course it does. If the human body is trying to store as much fat as possible, if you're using lots of energy, those hunger signals are going to go off the scale, and definitely more for some people than others. So exercise is important, but to lose a pound of fat through exercise, you have to be in a 3,500 calorie deficit. The maths is the same, but that's the same as running a marathon or doing a couple of 3-mile runs a week for a month if you don't eat any more.
And if you don't have a equivalent of a cappuccino a day, which would eliminate those 3-mile runs.
Exactly. So exercise is a really important part of general health and well-being, but I think people put falsely a bit too much hope on their exercise because it feels hard, and it you have to do a lot, and it's not the solution on its own.
There's a stat I learned that, so the recommendations, the government recommendations for moderate intensity exercise, something like brisk walking, is that we should be aiming to do at least 150 minutes per week. In order to use exercise as a strategy alone for weight loss without changing what you're eating, so that means without eating more because of the exercise, you need to do 2 times that. So, people who do lots of running, people who run to work and back every day, and it's, a good half an hour of running each day, probably, incorporating that and not changing what you eat, that is enough. But it is a lot that you need to do.
And you would have to really love the exercise, really enjoy the exercise, and not have that massive biological drive to consume some of the calories that you have. So
but
I think
for weight loss maintenance, it's incredible, isn't it? Because what happens is when we lose weight, the new weight, the lower weight, means that we use less energy at rest. So it kind of means what you were eating before just to maintain your weight, now you can only get away with eating slightly less calories than that. However, if you are exercising, and especially if you're putting new muscle mass on your body, which will burn calories, it can really help maintain the weight loss.
And I think that's often really not understood. So people had weight maintenance, they lose weight, they don't understand they now need to, their new maintenance intake needs to be lower. Than before. And it's also quite hard to gain muscle whilst you are in a calorie deficit.
Yes.
So building muscle is very hard if your body is busy burning fat. And so often it's about, and I try and get people to think about maintaining weight before stopping any diet. And of course, we're not promoting dieting and stopping because we know that doesn't work, but really focusing on when they're in a weight loss journey, what does weight maintenance look like? And once they're at weight maintenance, really focusing on building muscle mass at that point, because it's probably going to be more effective so that we can build up that basal metabolic rate. And we know that big, strong muscles are great for us in many ways. Even our brain seems to enjoy us having
And the more muscle you build, the more bone you build as well. And we won't get into osteoporosis today, but I think for women, especially in midlife, and especially if you then start losing weight, with weight loss, fat loss, you lose muscle, you lose bone as well. So, and I think that kind of it's one of my biggest worries and one of my biggest concerns when it comes to weight loss injections is that people may not understand that they will be losing muscle mass, losing bone mass alongside the fat that they're losing, unless they're taking these steps to preserve muscle, preserve bone through muscle strengthening exercise.
Yeah, I think people need to be more aware of how do they get to a good maintenance point and keep their body healthy.
So Petra, right at the start, I mentioned there's a lot of noise around this topic, and for sure, one of the biggest talking points is around weight loss medications. And I'm sure it's something we're both asked about all of the time. There's a lot of information out there. Some of it's good, some of it's not so good. So it'd be good to really sort of dig into what people really need to know. So from a clinical point of view, where do weight loss medications sit and how can they help people when it comes to health?
We have talked about how hard it is to lose weight, and harder for some people than others, and harder at certain times of your life than others. So I think it's important to recognise that weight loss is hard. And if you look at what medicine has been trying to do for the last 100 years, is we've actually been trying to find tools to help people lose weight. So in fact, there's been quite a lot of medications that have been around and thought to perhaps help. We've even used surgical methods to help people lose weight over the last century. So the first thing to say is weight loss treatments are not new as such. There are new weight loss treatments about. So I think what's important that we say is these are just tools to help people stick to a calorie deficit long enough to see meaningful changes in their weight for health. And I think that's the important thing we need to think about weight loss treatment. It's not going to fix your genes or your environment. It won't itself fix your lifestyle, but it will be a tool that might enable you to lose weight easier than without it. But it's very important that we think about the other elements of why one might be carrying extra weight, because unless you address those, the medication on its own doesn't fix any of those things.
And that's why I think there's a lot of talk about when people come off weight loss injections, the weight goes back on. It's like, well, of course it does, because, I mean, particularly if you have those genetic traits that we referenced, where you can eat a lot of food, you do have a very responsive brain, or, food noise, as it's often referred to. These medications help quieten the food noise. They make you feel full more quickly, more easily, and they reduce the drive to eat. But as soon as you stop the medication, the food noise comes back, the drive to eat comes back, the capacity to eat a large amount of food comes back. So what do people need to do alongside the medication in order to have a chance of maintaining weight loss longer term?
So I think it's firstly about being realistic about what the medication is doing. So you're absolutely right. The medication works on both our digestive system to reduce the amount that we eat, so it slows it down. So actually we don't eat as much, we get satisfied much quicker. It has a very powerful effect on the brain. And I think the effect on the brain is a thing that most scientists are finding super fascinating. You've used the phrase food noise. You and I hadn't heard the phrase food noise 4 years ago. That wasn't something that existed. And that's come out of patients using the medication, describing this preoccupation with food, these thoughts of food that magically they'll describe disappear
overnight.
Overnight with the new weight loss medication, which goes to show that the brain has a much bigger role in what we eat than we probably realise. So I think there's a lot that we're learning, and I think there's still a lot to learn about the best way for people to stay with their lower weight once they've stopped weight loss medication. But you're right, just like any diet, if you don't stick to the changes, your weight will come back. So important things to think about if someone has been on a weight loss medication or is thinking about starting a weight loss journey is making sure that you're going on a program that's really well supported. By that, making sure that you've had a good clinical assessment at the beginning, ideally by a doctor or nurse who's been especially trained in weight loss management, who understand obesity, who might understand your current diseases. We think lifestyle coaching is super important because it's not the medication that in the long run is going to make the biggest difference. It's what changes you make to your lifestyle, the things that are going to make the biggest difference. And the idea is making the changes whilst losing the weight is what will help keep the weight loss off. And then things we've talked already about the importance of keeping muscle mass up as high as possible, but making sustainable changes to the way in which you choose to operate your life. And also maybe thinking about what is a good BMI for you to be at. We know that losing just 5 or 10% of your body weight can be enough to have health benefits. So choosing a weight that is maintainable for you is really important. And that's why having a really high quality service to help you set those goals at the beginning. The Bupa Weight Management Plan, we set very specific goals with the person in mind. It's not according to an algorithm, but very much according to what the person wants to achieve, or even their non-weight related goals, so that we know when they've achieved that.
Who are these medications for? And what are the criteria for people being able to access them?
So these medications have been studied and are designed for people that are living with obesity, and that is having a BMI, a body mass index over 30, or living with overweight, which is a BMI over 27, if they have a weight-related condition. So it's a certain group of individuals who have been studied as appropriate for these types of medications. I would say it should be thought about as not the first step you would take. And the vast majority of patients that we see in the Bupa weight management plan have been on a long journey of weight loss and regain, that it isn't the first thing that they reach for. They often have tried many other mechanisms before. And I think that's appropriate. So it shouldn't be the first thing you do, because any drug, no matter what it is, comes with risks and benefits and side effects. And you have to balance all that up. So it's about it being right for the person.
I think one of my concerns is I know so many people out there that view these medications as a silver bullet, and they're getting by on eating just small amounts of processed food, not moving their bodies. They're seeing the numbers on the scale come down, so they're happy, but they're not actually a silver bullet, are they?
No, I think it is true that they really help control appetite, thinking about food, and most people taking the medication will absolutely reduce their intake of food and hopefully be in calorie deficit and lose weight. That is true. But like any other medication, if you stop it, the effects of the medication will wear off. So for a real effective weight loss, it needs to be the right kind of medication for you, specific to you, your needs and your goals. You need to have realistic goals, and it needs to be part of a holistic plan. At Bupa, we have the weight management plan, where we have a consultation with a trained doctor or nurse to talk about how you might start your weight loss journey, what treatment might be suitable for you and if it's suitable for you, but also setting not just a weight loss goal, but a non-weight loss goal. And then what's really important is lifestyle coaching, which we provide to help you make those changes to your lifestyle and your environment, so that any weight loss that you achieve might be maintained in the long term. And that might also include doing certain exercise, activity, building up muscle mass. And we also include a 24/7 access to a nurse helpline, because taking a medication comes with side effects and you want to feel that people are on that journey with you. So it's having the whole support around a treatment, which is likely to make it most successful for individuals, rather than just treating it as the solution on its own.
But on this topic of weight regain after the medication is stopped, the reality for a lot of people is they do regain the weight, don't they?
But I think actually that the jury is still out. And when you look at the evidence, so there was some evidence produced in the BMJ recently that suggested just that. But when you looked at the paper, it was of every weight loss medication that has ever been used and studied, of which there's been quite a lot of weight loss medications that were not nearly as impactful as the most recent group. So I think we need to be careful. There's some interesting data that I saw that has come out of the US, where these medications are being used quite differently to how they're being used in the UK. So used in very medical settings, funded by insurance companies. And we saw in that data that over 50% of people 2 years after stopping medication had actually kept all or more of the weight off.
Wow, okay.
So as far as I'm concerned...
Is that because the coaching element continued?
I am not sure. And I think for me, the jury is out.
Yeah. Mm-hmm.
And there is lots to learn. And I think we just need to be super open-minded. And it could be because, there's theories. If it's insurance funded, perhaps people stayed on the medication for longer. Mm-hmm. So they were able to make more significant changes to their shopping habits, to their food preferences, to how often they'd go out for dinner. Because we know behaviour change takes months, if not years, to set in.
Yeah.
Potentially in the UK, where people are self-funding, they may be on it for a shorter period of time, not long enough to make those behaviour changes. So I honestly think it's probably going to be years before we really know what the weight gain story is. But I think we can all be fairly consistent. If you don't change anything in your lifestyle and just stop a medication, the medication stops working. This is just common sense. But the data's a mixed bag.
There's certainly a school of thought amongst metabolic specialists, obesity specialists, that as we would with high blood pressure or diabetes or an underactive thyroid, if this is a medical disease and we have an effective treatment, that a patient should potentially stay on it forever. Now, I know the difficulty with that. One of the big difficulties is a lot of patients have to self-fund, and that can be quite expensive. So what are your views on that?
I think, again, it's going to be very interesting to see what the science and the evidence shows. We know that some of the drugs that we currently use for weight loss have been used for the last 20, 25 years in diabetics for really good effect, for long periods of time, very safely. So we don't immediately have any concerns about long-term use. And we know that there's going to be increasingly large number of different drugs coming onto the market, and that the prices of these drugs will drop down as well. I think it all comes down to the benefits and the risk, but I wouldn't be surprised if we end up at a time where certain individuals, it will be advised that long-term treatment might be of better benefit from them, because often we talk about risks and benefits with weight loss medication. We don't compare that to the risks and benefits of living with obesity and overweight, which we know carries significant risks. So, if I had let's imagine I've got a crystal ball, Zoe. I think we will get to the point where maintenance treatment with medication will be suggested for certain individuals. How and when that will look, I don't know, but it would make sense.
A lot of people feel judged or worry what others will think of them for taking weight loss medications. So why is there still so much stigma around it?
I don't know. I really don't know. It's as if we have not quite absorbed the fact that obesity is a chronic, complex condition. As as a population, we can't quite accept this to be true. And so therefore it's in a separate box from asthma or, heart disease.
And it is, isn't it? Because I know whenever I talk about obesity as a condition on my social media, you can guarantee the first comment, no, just eat less, move more.
and my personal theory is that's probably someone who inherited the really good genes and lives in a brilliant environment and loves exercising.
Well,
and so
is.
for them, this is an inconceivable thing.
Yeah.
Like, for them to be overweight or obese would require so many poor choices in their life that they can't put themselves in someone else's shoes. And I think there is a degree of empathy that we seem to have lost for individuals living with obesity and overweight. And we really need to challenge ourselves on that and the stigma that we might actually be perpetuating here.
There's something about it's so visible as well, isn't there? It's this chronic disease that you can't hide. Everybody can see. You have no right to patient confidentiality. Everybody knows your diagnosis because they can see it. And therefore, people will judge. And there are a lot of people out there that are unkind. I think also we've been subliminally delivered messaging around what it means for a person to be in a larger body since we were very, very young. If we think back to movies in the 80s and the 90s, if there was a child that was the bully, it was always a child in a larger body. If there was someone who was unkind, and therefore subliminally we've been delivered these messages. So we all have our biases, even us, we all have these biases, and there's something about looking deep inside ourselves and challenging those biases so that we can live, I guess, just in a kinder, fairer world.
Yeah, and I think there's also that real risk that as we talk about breaking down stigma of obesity, we've got some much more effective treatments and tools available, that some people interpret that as us trying to make everyone uniform, and that's the end of a body positivity movement. And I think it absolutely isn't. I think what it is recognising that people can choose to live how they want to, but with the body shape that they want. But these are tools for people who really want to reduce their BMI for health reasons.
Yeah.
These are tools to make it easier for them. It's not to make everyone look the same.
And there's so much nuance in all of that. Body positivity, my hope would be for every single person, whatever their body shape or size, to feel positive about themselves. But we are talking about a disease and we are talking about health. And some people can be healthy in a larger body than others. But we all have a tipping point at which disease process, it might take 10 years for type 2 diabetes to develop or for joints to become painful. But we all have a tipping point at that when we exceed a certain body size, disease processes will start. So, we're sat here as doctors. That's why it is important we're having this conversation, even though some people don't feel comfortable with it. And it's important that people recognise and understand the help and support that is potentially available to them and the methods of managing this disease that are more likely to work.
Yeah, and I think there's so much in the media about celebrities using this medication that it's almost been twisted to suggest this is just almost like cosmetic medicine, a bit like a medical version of plastic surgery. It absolutely isn't. This is a tool for the management of a chronic disease, a disease that causes quite a lot of harm and discomfort. And it appears to be very effective and to be really well tolerated.
And I guess whilst recognising that with any advancement in technology, any new drug, there are some risks and actually there are some downsides if the wrong people start using these medications where they can cause more harm than good. Anyway, as you can imagine, we've had so many questions come in for you, Petra. So let's see what we've got. If I start taking weight loss medication, could it affect my period or monthly cycle? I'm a bit worried about that.
It's a good question. Any change in weight, certainly if it's fast, can affect how your periods respond and your periods can change. However, what I would say, anyone that is taking weight loss medication, it should be under medical supervision. You should be able to speak to your prescriber to talk about any concerns you've got about your current health, your previous health, any other medications you're on to make sure that any interactions have been considered. So I think if this is you, make sure that you're talking to a doctor or nurse who is prescribing the weight loss medication to make sure that you can understand what to expect and who to contact if something happens that you don't expect.
And I think if you're not able to do that, if you're having prescribed medications and the prescriber or that information or that advice isn't accessible, it's a bit of a red flag.
Yeah, I feel quite strongly that this is a medication that might affect many parts of your body and other medications might be important, that really speaking to a doctor or nurse, having a proper consultation before you start it so you set your expectations clearly is the best way to do that. And that's what we do with the Bupa Weight Management Plan.
I'm going through menopause and I feel like my weight has suddenly become much harder to manage. Is that normal? And what can I do about it?
How many times have you heard this in your surgery, Zoe?
Hundreds. This is the group of people who I think are using these medications more than any other. It's women in midlife who are struggling with their weight in a different way to whatever they have before because of the changes in their hormones.
Yeah, so we know hormonal changes, we know changes that the menopause bring to our muscle mass, to our body fat. The time of life that menopause hits, where women are often the sandwich generation focusing on children and parents and, often demanding careers and cortisol levels. These do not combine for an ideal environment to lose weight or maintain a healthy weight. Most women will describe a degree of increasing weight, and particularly in certain parts of their body they don't want to, normally their tummies. Yeah. So there's lots we still don't understand about exactly the mechanisms at play. But yes, that is common in the perimenopause and menopause area. And that is certainly, we are seeing a lot of women that are turning to weight loss medication as a tool to help them at this time.
Petra, thank you so much. Like, so many insights there. I think we could probably talk about this topic all day long. We're going to take a short break there, but when we come back, I'll be chatting to Nuala Armstrong, who's a health coach, and we'll be getting her expertise. And now for our next segment, I'm joined by our health coach, Nuala Armstrong. Together, we're going to explore what effective, realistic weight management looks like in everyday life and the kinds of tools and habits that can genuinely help. So we've talked about weight loss medications, but that's just one part of the picture. Most people manage their weight with habits and lifestyle, and some people need support, but I think a lot of people want to make healthier changes, but motivation can really wane. So what types of support or tools are there that can help people make new habits that stick?
Yeah, absolutely. So I think for a start, not relying on motivation, relying on energy and kind of waiting for that right time, having that structure, even if it's just 10 minutes, to get moving, that's going to make a difference and it's going to get you in that right mindset as well. Another thing as well is exercise clubs. So dance clubs, running clubs, you've got that kind of social support. You've got the accountability of you've got to be there and showing up for people as well as yourself as well. And also mixing that exercise with the social side just makes it more fun in general. And obviously if it's more fun, we're going to do it more long term. And lastly, in terms of tools, I think tracking is really useful. So we've just got that objective data that we can compare, check your progress as well. So whether that's in diet with tracking your calories, tracking your protein, tracking your fibre as well. Most people don't get enough fibre. And on the exercise side of things, having a certain step count per day or tracking your progress with running and just seeing those metrics just makes it more kind of visible and you can kind of track that progress.
We talked earlier about muscle and strength and how important they are when somebody's trying to manage their weight. What are the simplest ways that people can incorporate some muscle strengthening exercise? I mean, or other types of exercise, especially if they're short on time?
Yeah, so again, I think just keeping it simple, small swaps. So if you can just take the stairs instead of a lift, if you can maybe cycle to work instead of driving as well, all these small swaps are not going to seem, as big a change as trying to add in some structured exercise. It's just part of, your daily commute, getting from A to B. But it's definitely going to make that difference long term as well. So just those small swaps that you can just add in, and increase it from there. Another thing is just kind of make the workouts work for you. So, if you want to start strength training, but it's not feasible to get down to the gym, maybe just looking at getting some weights at home or just starting off with body weight is equally just as good. And even better long term because it means that you're going to be, you've got that regular access so you can keep up with it long term as well.
I think what I hear already is there are lots of different ways, and I guess that's your role as a coach, is it, to help the person find out within the context of their own lifestyle where it does fit without it feeling like another thing that they have to do?
Yeah, absolutely. Because if you don't enjoy it and it doesn't work with your schedule, it's just going to be a chore. It's going to be really difficult. It's going to cause stress. So we just need to keep it simple, keep it enjoyable as well. I think that's the main thing, is finding that sport, that form of exercise that you enjoy. So you look forward to it and you can just kind of change that perspective as I get to work out and now get to do my exercise after work rather than it just being another kind of job on that list.
I think thinking about our long-term health, so not just weight loss,
Yeah.
What does good preventative health care look like for a person?
So we talk a lot about structure, routine, and I think a really good way to stay on track with that is making sure that you're meal prepping. So even if it's just setting time aside on a Sunday to do a big batch of, even just a one-pot dish, so you've not got loads of washing up as well. You can put it in the freezer for those days where you're feeling tired, stressed, you come home, that's when we reach for those convenience options. So you've got that ready, prepped in the freezer. It's going to be a nice nourishing meal there ready. Also going to save you money rather than ordering something online or going to the shop and trying to start thinking of what to cook then. So yeah, meal prepping is, I would say, the number one to help you stay on track. You've got all these pre-planned meals, you've got your proteins, everything probably measured out in the right proportions, all ready to go. So it just takes that kind of guesswork and that stress out in a busy kind of week situation.
What about things like sleep and stress? How much can they influence somebody's ability to maintain their weight? And do you have any tips on how we can manage these better?
Yeah, so both can have a really big impact. So what we eat throughout the day can affect our sleep quality at night. Poor sleep quality can then affect our food choices the next day. So if you have a poor quality night's sleep, it's going to increase the hormone ghrelin, which stimulates appetite as well. So you're more likely to overeat the next day. So yeah, it's really important just to kind of go for whole food options. Again, high fibre, avoiding or trying to minimise those ultra-processed foods, reducing caffeine intake throughout the day, avoiding alcohol before bed and things like that. And with stress, again, has a really big impact. So sort of on the psychological side, we obviously, when we're stressed, we're feeling tired, we can rely on comfort eating. So it just, again, can lead to that increased calorie intake. And also from a physical perspective, in increasing cortisol, the stress hormone, can actually increase weight gain as well around the sort of abdomen area as well. So it's really important to kind of have that stress management so that the stress isn't driving your food choices.
I think I hear that a lot, especially from women who are perhaps middle-aged, so their hormones influence their ability to manage their weight, but also they'll say, I'm doing everything right, I'm eating really well, I'm exercising loads, I'm in a calorie deficit. But if your body's in a state of stress, your body's trying to keep you alive and protect you, and therefore it does hold on to energy, doesn't it? And makes it even more challenging.
Yeah, there's just so many factors that, like, say on paper, it can be I'm in a deficit, but if you've got that kind of inflammation, that stress, it's going to affect all these other things that has a knock-on effect and can make you feel worse. Like you say, you feel like you're not getting anywhere with your progress. So yeah, it's just establishing a sort of management tool for each one of those areas as well to kind of keep everything under control.
So do you sometimes then have scenarios when you're working with somebody where actually their strategy is not too much to focus on food initially? Are there other areas of their life that it's helpful to take action in first, such as managing sleep or stress?
Yeah, 100%, because they can drive our food choices. So I think most of the time it isn't that physical hunger that we're dealing with. It's why we're making those food choices, why we're eating maybe late at night, why we're going to alcohol for stress management. So it's kind of pinpointing that stress and addressing the root cause of that first of all. So then the diet kind of follows naturally as well. And obviously if you improve the diet, that will help to improve sleep quality, have more energy the next day. So we're more likely to meal prep, exercise more. So again, it just has that knock-on effect. So yeah, definitely important.
We often talk about a vicious cycle, don't we? But this is great because this is like the opposite of that. This is like every action you take in every aspect of your lifestyle has a positive knock-on for the next.
Yeah, so it's not always negative. You can have that positive outcome as well.
Okay. Nuala, what about mindset? How should we be thinking about weight and health?
Yeah, so I think changing that perspective to a longer term approach. So living a healthy lifestyle rather than a quick fix, a quick diet. So looking for those, again, small habits that we can change long term that is going to be sustainable. I think taking the pressure off as well, having that balance, sort of looking at an 80-20 approach. So, looking for that structure in the week, maybe having your meal preps, your exercise routine, and it just allows for those opportunities to go out with family, friends for those events that are kind of already booked in without feeling too much guilt around that.
So 80-20 is 80% of the time you're on it, you're being consistent, and 20% of the time you relax it a little bit.
Yeah, for when life happens, so we can enjoy that as well.
I think diet culture for decades has told us to restrict and, pat on the back when you don't eat enough food and you manage to tolerate your hunger, and all the shame and stuff that people have attached to their eating habits. And so it's really refreshing actually to hear you talk about everything in such a positive way. It's not about motivation, it's about structure, it's about consistency, it's about eating and nourishing your body and giving it the things that it needs, like fibre, and it's about doing things that actually fit into your own life. So it's really refreshing. I think for a lot of people it's a different way of looking at it. That mindset is so important. We've got lots of people watching who've been asking questions today, so shall we get into a few of them?
Yes.
So the first one, whenever my mental health dips, I find myself turning to food for comfort. How do I break that cycle without feeling like I'm failing all over again?
Yeah, absolutely. So I think, again, going back to addressing the root cause of, the mental health concern there. So whether it's anxiety, if you can get sort of talking therapies for that, certain hobbies that can help, the social support. So again, when you're feeling sort of more confident, you're not relying on the food for that comfort. So addressing, the root cause of the stress, anxiety, whatever it might be. And then obviously using food for comfort, but in a positive way. So having like a hearty dish. So maybe like a chicken and halloumi tray bake, or something like comforting food, like a lentil dal, something like that, that's going to still be comforting, but also provide you with all the right nutrients as well. Because like you say, we want to try and kind of in a way eat more to nourish ourselves, hit kind of protein goals, get enough fibre. So we want to make sure we're eating enough to support ourselves and our mental health as well.
Okay, next question. I'm often eating or drinking out and it's hard to stay on track with my health goals. What are some simple ways to manage my weight when I'm not at home? Hard. Yeah, it's tricky, that
absolutely. It is. It's difficult. So I think it's really important to still enjoy eating out, but just having those tools to kind of put in place so that we feel that we still got that control. So the first one would be, if you're going for like an alcoholic drink, try and go for low alcoholic or even non-alcoholic option there as well, because obviously the added calories in alcohol is going to contribute to your overall intake that day. Also the extra sugars, it increases appetite as well. So you've got the added calories and you're more likely to overeat as well. So just trying to go for a non-alcoholic version of drink would be really useful. Swapping maybe every other drink for a flat drink or water as well. So you're going to kind of, if you are going for alcohol, you're going to cut that consumption in half, but also help to stay hydrated.
Zebra drinking, I hear the term
Zebra
is.
Drinking, that's the one, yeah. So that's really useful as well for keeping hydrated, keeping balanced. In terms of the food that you're eating, going for the 2 Ps, so protein and plants. So going for your leaner protein options if you can, chicken, fish, tofu, rather than your red meats. And again, plenty of vegetables, fibre if possible. Obviously, it's not always viable with the options that are there, but if you can, just going for those options. Another one, just being mindful of added extras in there as well. So sort of mayo, creamy, cheesy sauces, extra dips. Again, all these can kind of add on to that caloric intake in the day as well. And lastly, it sounds a bit counterintuitive, but kind of keep eating throughout the day, keep yourself nice and full, so that you're not turning up absolutely starving, because that's when we're going to have less control of what we're eating and how much we're eating as well. So even if it's just a healthy snack beforehand, that can help as well.
Because what we're talking about here is that 2 a.m. kebab, aren't we? When you've
yes.
you give in to the 2 a.m. kebab. We've all been there.
We've all been there.
So we've got a question from a man here, which I think is great. So let's take this one. It says, "Hi, I'm in my 40s. I've always felt like men aren't really supposed to talk about struggling with their weight. It feels a bit embarrassing to admit. So what's a good first step for someone like me?"
Yeah, and I can understand why he might feel like that. Body image isn't sort of, discussed as openly as it is with women. So it's understandable. But I think a first good step would be just taking those small wins again. So going for those small stackable habits. So whether that's, just getting to bed 15 minutes earlier, going for 1 less teaspoon of sugar in your tea, coffee, things like that. These are going to establish the sort of foundation for long-term change then without too much pressure. And I think also telling someone that you trust about your intentions, so that you've got that social support, but also that accountability as well without too much pressure.
Okay, it's really good. I like that the small stackable, sustainable, because that's what we're talking about, aren't we? If you can make a change, such as having 1 less spoonful of sugar in your tea, and you have 2 cups of tea a day, and you're going to drink 2 cups of tea for the rest of your life, that adds up. Over the years, that adds up, and it's really significant. But it's something that once you make that change, you can sustain. But it's identifying as an individual what are the right changes for you.
Yeah.
Nuala, thank you so much. That was really, really interesting. And I think some brilliant tips there for all of us. And I think just a way of thinking that's more helpful when we're on a whatever health journey we're on.
Yeah, absolutely. Thank you.
Thank you so much, Nuala. And thanks to Petra as well for sharing her insights today. Weight is complex, it's personal, and it's often emotional, but it's also something we can understand better when we look at the whole picture. Thanks for joining us, and we'll see you next time on Inside Health.